So hello guys, welcome back to my channel, and today we will be discussing on the topic permanent mandibular lateral incisor. So let's begin. First we will be seeing the chronology. So basically what is the first evidence of calcification? Okay, so the first evidence of calcification was 3 to 4 months. Okay, next, enamel. When was the enamel completed, or when was the enamel formation completed? So this happened at the age of 4 to 5 years. Then eruption. After the enamel completion comes the eruption. So the eruption of the tooth happened 7 to 8 years of age. And last one, root formation completed. So when did that happen? That was at the age of 10 years. 10 years of age. So this was the chronology of permanent mandibular lateral incisor. Now a few points I would like to discuss is that the permanent mandibular lateral incisor are 2 in number that we know, and they closely resemble the central incisor, the mandibular central incisor. And these, as I told in the central incisor, that the lateral ones are a bit greater in dimensions. So the permanent mandibular lateral incisor are greater in dimensions than the permanent mandibular central incisor. Now let's see the different aspects of this tooth. So moving on, we will be discussing each aspect of this tooth one by one. So first, let's discuss about the labial aspect of the permanent mandibular lateral incisor. So what can you see from the diagram? So we see, as we saw in the central incisor also, the mandibular central incisor, the two mesial and the distal marginal ridges are equal. Okay, they are equal, they're even, and they're sharp, and their meso and the disto-incisal angles are 90 degrees. So this feature is same. One difference is that the if you compare the mesodistal diameter of the crown, it is 1 millimeter larger than that of the permanent mandibular central incisor. So the mesodistal diameter, it is a bit larger, that which I just told before, that the lateral incisor is a bit greater in dimensions than the central. So here it is 1 millimeter more, and the incisal ridge is straight, you can see over here, and the mesial and the distal outline, both the outlines are straight. We finished this, and both of these form the 90 degree over here. Now let's talk about the contact area. So the contact area of both mesial and the distal side, they lie at the junction of the incisal and the middle third. So as we know, this is the incisal, okay, area. This is the middle area, and this is the cervical area. So this is the junction of the incisal and the middle third of the crown. So these are the contact areas of the mesial and distal side. Now, the mesial and the distal sides taper evenly from the, so first when you see from the uh, incisal side over here, the mesial and the distal side taper evenly from the contact area to the narrow cervix. So here it was a bit straight, but as we go like this, they taper from the contact area, the outlines taper, and the labial surface is smooth and flattened, and the incisal third is more convex at the middle third. Okay, it is more convex over here, and they narrow down to convexity of the root and the cervical portion. So here the outlines narrow down to form this root. So the root is similar to the permanent mandibular central incisor as we have discussed before, and the apical third of the root, it is a bit distally pointed. It is taper at the apex and it is distally pointed like this. Okay, so these were some features of the labial aspect. Moving on to the lingual aspect. So the lingual aspect, the mesodistal diameter of the crown, here also it is more, or it is greater than the central mandibular central incisor, and the lingual surface is smooth and it is straight at the incisal third between the less prominent marginal ridges. What does this mean? So the crown, it is smooth and it is straight, and there is a slight convexity, okay, at the incisal third between the less prominent marginal. So in the lateral incisor, the marginal ridges are not that prominent, but okay, there are marginal ridges over here, and there is this convexity over here which we call the lingual fossa. So there is slight convexity, it's not that deep, okay, and the marginal ridges are more prominent near the incisor ridge. Okay, it's more prominent over here than over here, than over the middle side, middle third. Now the concavity between the marginal ridges is more distinct. Over here near the marginal ridges, it is more distinct, the concavity, and the lingual surface becomes flat and then convex as it progresses to the cervical third. Because of what? Because of the cingulum. There's a cingulum present, so there's a convexity over here, concavity, slight concavity over here, and convexity on the cervical third. Okay, but here also similarly as we saw on the central incisor, there is no developmental group or developmental line over here which marks the cingulum, and the root is also similar to the labial aspect as we saw, same only. And now coming to the mesial aspect. So the mesial side of the crown is often longer than the distal side. So the mesial side is a bit longer than the distal side, and the curvature, the labial, so the labial, the lingual curvature will be discussing individually the outlines. Okay, so they labially and lingually above the cervical line, this curvature which we have, this curvature we're talking about now, what is this called? The curvature of the cervical line. So it is less uh, than the permanent maxillary incisor. Here we're comparing between the maxillary incisors over here. Okay, so the curvature of the cervical line, it is lesser than the maxillary central or lateral incisor. Now coming to the labial outline, this labial outline, it is straight above the cervical, the curvature of the cervical line. This is the cervical line, right? So it is a bit straight over here, but as we move to the middle and incisal thirds, it becomes like this. Okay, it becomes curved, it is sloping, and it, and it is, as we go to the incisal, right, it becomes curved. So, and in the lingual outline, this is the lingual outline, the straight and inclined the lingual outline is straight and it is inclined labially just above the convexity of the cingulum. So just above the convexity of the cingulum, over here somewhere, it is straight. Okay, and the incisal ridge is straight and gradually sloping downwards in the distal direction. So this incisal ridge is also straight, and the cervico-enamel junction curves incisally at the junction of the cervical third and the middle third of the crown. So this curves like this, okay, to the incisal third. It is pointing like this, okay, so it points over here. That's what the statement means. And the mesial surface is convex and smooth at the incisal third and becomes broader and flatter at the middle third to the cervical area. So it is smoother over here, okay, in the incisal third. Now coming on to the root. The root is similar to the permanent mandibular central incisor. The root is straight. Okay, it is generally straight till here. But as we come over here to the junction of the mid in the apical region, the middle and the apical region, this is the kind of the junction over here. So from here it starts curving, or I'll just read out the statement. It starts tapering. That is the correct word. It starts tapering like this. Okay. From the junction of the middle third and the apical third till the apex. This is the apex. So this surface is flat just below the cervical line. A developmental depression is present mesially. So there is a developmental depression, but this developmental depression is deeper where at the junction of the middle and the apical third. So it is deeper over here. There are development. It is here also, but it is not that deep. It's deeper over here. Now coming on to the distal aspect. The distal aspect is very similar to the mesial aspect. There is nothing much to be discussed over here. The same labial and the lingual outline, they have the concavities and convexities. Okay, so the mesial contact area is more forward. Okay, the mesial one, the only comparison I'm telling you here is the mesial contact area is more forward, the cervical line, than the mesial contact area. Mesial contact area is more forward over here. So the prominent mandibular lateral incisor make the proper contact with the mesial contact area of the mandibular canine. What does this mean? The permanent mandibular lateral incisor, this tooth, makes a proper contact with the canine. Okay, there are mandibular canines also at the side, so they make a proper contact there, where we had discussed at the junction of the middle in the incisal third. Okay, there is the contact area, so there they contact, and the root is also same over here. There are developmental depressions over here, and they're well defined grooves, and this groove is in the center. Now coming on to the last aspect, that is the incisal aspect. This is very very important, as this has that characteristic feature which we had discussed in the central mandibular central also. So first let's just start with the first point, that is the incisal aspect provides a feature that can usually serve as to the identity of this tooth. So it serves as a feature how to identify which tooth it is. So first, the incisal edge is not approximately at right angle to the line bisecting the crown. So probably this is the line bisecting the crown or something like this, and it is not proper 90-degree over here with the incisal edge. Okay, this is the incisal edge, but this is not proper 90-degree. Okay, so in the central in the mandibular central incisor, we saw that it was proper 90-degree. The labiolingual line that bisects the crown was perpendicular to the incisal edge, but in the lateral one it is not so. And so the excuse me, the right angle, okay, so we have discussed this, and therefore this gives an appearance of the crown being twisted and slightly on its root base. So as we can see, if this line is bisecting, it is not straight, it is tilted. So the whole tooth from this aspect, or whatever, it appears like the tooth is a bit tilted. But this labiolingual root axis at the mandibular central and the lateral incisor remain almost parallel. So the root axis, that is this root axis, you know, right? This is the root axis. You can only see from the labial or lingual or these aspects, not from this. I mean, it will only be a point. So this root axis, right? So this is called a root axis, and this root axis, it is parallel. For supposing this is my lateral incisor, and I can just draw a central one also over here. So their root axes are parallel. This is the meaning of this statement. Their root axes are parallel, almost parallel, in the alveolar process, even though the incisal ridge are not directly in line. So the incisal ridges of these are not directly in line. Like for this, it is bit tilted, so it is not 90-degree, but for central it is straight, so it forms a 90-degree. So even though this is a factor, but it doesn't change the fact that these lines are parallel. They are fit in the alveolar bone like this, right? Supposing this is my alveolar socket. So these lines that are the root axis, they are parallel. Alright guys, that's all for today. Thanks for watching the video. Hope you liked it.